Today I'm talking about my patient Christina. Christina presented to me with some really severe crowding. When we have a look at her facial photos, you can start to see some of her concerns. I mean, the crowding is quite severe, and it's even apparent that she has a crossbite between some of her front teeth. But what might not be so obvious and a little more subtle is that her lower jaw is actually very large and very prominent. You can see that her lower jaw sticks out a lot further than the rest of her face. When we start to have a look inside her mouth, we can see just how severe that crowding is. She has a crossbite here, a crossbite there as well, and one there too. So really, there just wasn't enough room to fit all of her teeth in the proper alignment. So with Christina, what we had to do was remove some teeth. Now that wasn't to create space, but more so actually to deal with her facial profile. We did orthodontic extractions of premolars, and we had Damon braces for 18 months together with bite turbos and elastics. And this is the end result which we were able to achieve. A much wider, fuller smile in perfect alignment. Looking inside her mouth, we can see just how severe that crowding was. And here she's already had those teeth extracted, and here they're all nicely aligned. So this is the before and after result following orthodontic extractions. So Christina was in the unique position of having a very forward or very prominent lower jaw, and following the extractions we can see that her lower jaw has been brought back more in line with the rest of her face. And in this picture we can see some of those subtle differences that has made. We can see her lower jaw is less prominent and not quite as full as it was before, and it's also made her jaw a little bit slimmer. So she's very happy with that result.